Every single minute, somewhere in the world, another person loses part of their brain forever because of a stroke. Not tomorrow, not years from now, right now. And what makes this even more frightening is that many of those people were not completely blindsided. In the hours, sometimes even days, before the major stroke happened, the brain was already sending warnings. Small warnings, temporary warnings, moments so brief and so easy to dismiss that most people ignore them completely. A strange numbness in one arm, words suddenly becoming difficult to say, a few seconds of blurred vision, a strange wave of dizziness that disappears before they even decide whether it matters. Then life goes back to normal. They continue their day. They go to sleep. They tell themselves it was stress, exhaustion, dehydration, aging, or anxiety. And then the real stroke arrives. One morning they cannot move half their body. One afternoon they suddenly collapse in the kitchen. One ordinary moment changes the rest of their life permanently. And here is the part I need you to understand today. The symptoms disappearing does not mean you are safe. In many cases, that temporary recovery is actually the most dangerous stage of all. Because what just happened may not have been random. It may have been your brain warning you that a much larger event is coming next. My name is Dr. James Carter, and for years I have focused on stroke prevention, vascular aging, and neurological health in older adults. And in this video, I am going to show you the warning signs many people experience before a major stroke occurs. Why these symptoms often disappear, why people underestimate them, and what you should do immediately if they happen to you or someone you love. Please stay with me until the end, because understanding these warnings quickly enough could genuinely save a life. Not someday, possibly within the next few days. Before we talk about the warning signs themselves, you need to understand what is happening inside the body during the days leading up to a stroke. Because once you understand that process, the symptoms suddenly become much harder to ignore. Most strokes are what doctors call ischemic strokes. That means blood flow to part of the brain becomes blocked, usually by a blood clot. You can think of it like a major highway suddenly being shut down. The brain depends on a constant supply of oxygen-rich blood every second of the day. Unlike many other organs in the body, brain tissue cannot survive very long without oxygen. When blood flow stops, brain cells begin dying within minutes. And the frightening reality is that the brain itself does not feel pain the way other parts of the body do. So instead of pain, it sends dysfunction. Speech problems, weakness, vision changes, confusion, loss of coordination. Those symptoms are the brain's distress signal. But what many people do not realize is that a major stroke is often not the first event. In a large number of cases, the brain experiences temporary interruptions in blood flow before the catastrophic stroke finally occurs. These episodes are called Transient Ischemic Attacks, or TIAs. Some people refer to them as mini-strokes, but that term is actually misleading because it sounds harmless. A TIA is not harmless. A TIA happens when blood flow to part of the brain becomes blocked briefly, then restores itself before permanent damage fully develops. The symptoms may last a few minutes, sometimes 30 minutes, sometimes less than an hour. Then they disappear completely. And this is where the danger begins. Because once the symptoms vanish, most people convince themselves nothing serious happened. They delay medical care. They wait until next week. They decide to monitor it. They tell family members, "I feel okay now." But medically, that moment is extremely dangerous, because the same unstable blood vessels and clotting problems that cause the temporary blockage may still be active. And for many people, the full stroke follows shortly afterward, sometimes within 24 hours, sometimes within 48 hours, sometimes while sleeping the very same night. I once had a patient named Robert, a 67-year-old retired mechanic, who suddenly lost the ability to speak clearly during breakfast. His wife said his words became scrambled for about 10 minutes. Then everything returned to normal. Robert refused to go to the hospital because he felt embarrassed and thought maybe his blood sugar was low. The next morning, he suffered a massive stroke that permanently affected the right side of his body. And unfortunately, stories like that are not rare. That is why recognizing these early warning signs matters so much. The brain often whispers before it screams. And the people who survive best are usually the ones who listen early enough. The first warning sign is sudden weakness or numbness on one side of the body. This is one of the most common and most important neurological warnings the brain can give. Notice the key word here: sudden, not gradual, not something developing over months, not the stiffness of arthritis or ordinary muscle fatigue. This happens quickly. A person may suddenly feel one arm becoming unusually heavy. They may try lifting both arms and notice one slowly drifting downward. They may suddenly drop a cup, struggle to grip objects, or feel their fingers becoming strangely clumsy. Sometimes the face is involved too. One side of the mouth may droop slightly. A smile suddenly looks uneven. Family members often notice this before the person experiencing it does. And sometimes the leg becomes affected as well. The person may drag one foot slightly or feel unstable while walking. What makes these symptoms especially dangerous is that they may disappear quickly. 10 minutes later, the arm feels normal again. The speech improves. The face returns to normal. And that false sense of relief becomes the trap, because temporary recovery does not erase what just happened inside the brain. It only means blood flow returned before larger damage occurred, and that window may be closing rapidly. The second major warning sign is sudden difficulty speaking or understanding language. This symptom can be terrifying because it feels deeply unnatural. A person suddenly knows what they want to say, but the words will not come out correctly. Sentences become scrambled. Speech becomes slurred. Simple words disappear. Sometimes they answer questions with responses that make no sense. Other times they understand everything being said around them, but physically cannot form the correct words. Family members often describe it as if the person suddenly became confused out of nowhere. And once again, these symptoms may last only minutes before disappearing. That temporary disappearance is exactly why so many people make the mistake of ignoring it. Please understand this clearly. Healthy brains do not randomly lose language function for several minutes. If speech suddenly changes without explanation, especially alongside weakness or numbness, you should treat it as a medical emergency immediately. Not tomorrow. Not after a nap. Immediately. Because every minute matters when brain tissue is at risk. The third major warning sign is sudden changes in vision. This symptom is extremely important because many people do not associate vision problems with stroke risk. But the eyes and the brain are deeply connected through blood vessels supplying oxygen to critical visual centers. Some people suddenly experience blurry vision in one eye. Others describe a dark shadow moving across their field of view like a curtain being pulled down. Some temporarily lose vision in one eye entirely for several seconds or minutes. Others develop sudden double vision without any obvious explanation. And once again, the defining feature is suddenness, not gradual worsening over months. Not needing reading glasses, not ordinary eye strain. A sudden, unexplained visual disturbance can be one of the clearest warnings that blood flow is being interrupted somewhere in the vascular system connected to the brain. One particularly dangerous symptom is temporary blindness in one eye that later resolves completely. Many people ignore this because vision returns quickly. But medically, it may represent a temporary interruption of blood flow in arteries strongly associated with future stroke risk. Never assume sudden vision loss is harmless simply because it improves. The fourth warning sign is a sudden severe headache unlike anything you have experienced before. Now, not every stroke involves headache, but hemorrhagic strokes, strokes caused by bleeding in the brain, very often do. Patients frequently describe it as the worst headache of my life, and what separates this from ordinary headaches is how rapidly it appears. It does not slowly build throughout the day. It explodes into full intensity within seconds. Some people feel nausea. Some become sensitive to light. Others suddenly feel confused, weak, or unable to stay balanced. Doctors sometimes call this a thunderclap headache because of how violently and suddenly it arrives. If a headache appears with extreme sudden intensity and feels profoundly different from your normal headaches, that situation requires emergency medical evaluation immediately, especially if it appears alongside weakness, speech difficulty, confusion, or visual changes. Because bleeding inside the brain is a true medical emergency, where rapid treatment can mean the difference between recovery and permanent disability. The fifth major warning sign is sudden loss of balance, coordination, or stability. This symptom often gets mistaken for simple dizziness or fatigue. But stroke-related balance problems usually feel very different. A person may suddenly begin veering to one side while walking. They may stumble without understanding why. They may feel as though the floor is shifting underneath them. Others describe a sudden inability to coordinate normal movements properly. This happens because important structures near the back of the brain control coordination, balance, posture, and smooth movement. When blood flow becomes disrupted in these regions, the body suddenly loses its normal sense of spatial control. And unlike ordinary dizziness from standing up too quickly, these symptoms often appear without any clear trigger. No sudden position change. No spinning room sensation. Just abrupt instability. Sometimes these balance problems appear together with nausea, blurred vision, or slurred speech, and that combination should never be ignored. But there are also several lesser-known warning signs many people miss completely. Sudden confusion, brief episodes of extreme disorientation, unexpected mental fog, short periods where familiar surroundings suddenly feel strange. Some people experience sudden exhaustion so overwhelming it feels almost unnatural. Others describe numbness specifically around the mouth or face for a few minutes before it disappears. And sometimes the symptoms are incredibly brief. Only 30 seconds, only 1 minute. That short duration tricks people into dismissing the event entirely. But neurologically, even a short interruption in blood flow can be a massive warning sign. This is why stroke prevention is so difficult. The brain often gives subtle warnings before catastrophic damage occurs, and human nature encourages people to minimize symptoms once they start feeling normal again. But stroke medicine does not work that way. Temporary recovery does not erase future risk. Sometimes it increases the urgency dramatically. If you remember nothing else from this video, remember this acronym: FAST. F. Face drooping. Ask the person to smile. Does one side of the face sag or appear uneven? A. Arm weakness. Ask them to raise both arms. Does one drift downward unexpectedly? S. Speech difficulty. Are words slurred, confused, or difficult to understand? T. Time to call emergency services immediately, not later. Immediately. And I want to add something extremely important here. Do not wait for symptoms to return. Do not wait to see what happens. And please do not go to sleep hoping things improve in the morning. That delay can permanently change someone's future. Because in stroke medicine, we use a phrase constantly: time is brain. Every minute without proper blood flow means more brain cells dying. And modern stroke treatments work best within very specific time windows. The faster doctors identify the problem, the greater the chance of preserving brain function. Emergency evaluation after a TIA or stroke warning may include brain imaging, blood vessel scans, heart monitoring, blood pressure assessment, and medications designed to reduce the risk of another clot forming. Sometimes treatment started within the first 24 hours prevents the major stroke entirely, but those opportunities disappear quickly. And unfortunately, many people lose that opportunity because the symptoms temporarily went away and they assumed they were safe. Please never make that mistake. If symptoms appear suddenly, even if they later disappear, seek emergency care the same day. Your future brain may depend on it. One of the hardest truths about stroke is that damage often builds silently for years before symptoms finally appear. High blood pressure, poor vascular health, smoking, diabetes, chronic inflammation. These problems slowly weaken and damage blood vessels long before a major event occurs. That is why prevention matters so much. Not fear, not panic, prevention. Over the years, one thing became very clear to me. The people who protect their long-term brain health are usually not the people doing extreme things. They are the people consistently following small, healthy routines every single day. That is one reason I created the Blood Pressure Reset Guide, a simple structured program designed to help older adults support healthier blood pressure habits through gentle movement, daily routines, nutrition awareness, and consistency. Because stroke prevention is not usually about one miracle solution. It is about reducing stress on the vascular system day after day before the emergency happens. If you want more information about that program, you can check the link below this video. But more importantly than anything else today, I want you to remember this. Your brain often warns you before a stroke. The tragedy is that most people do not recognize the warnings until it is too late. So if you ever experience sudden weakness, sudden speech changes, sudden vision problems, sudden balance issues, or sudden severe headache, take it seriously immediately. And if someone you love experiences those symptoms, do not let embarrassment, denial, or temporary improvement stop them from getting evaluated, because one fast decision could save decades of quality of life. If this video helped you, write in the comments whether you or someone close to you has ever experienced symptoms like these before. I read those comments carefully, and they help shape future videos on this channel. And please share this video with someone you care about. The person who needs this information most is often the person least likely to search for it themselves. I'm Dr. James Carter. Thank you for watching. And remember, when the brain whispers, listen carefully before it has to scream. Disclaimer. This video is intended for educational purposes only and is not personal medical advice. If you or someone around you experiences possible stroke symptoms, seek emergency medical care immediately. Do not use online videos to diagnose or delay treatment. Time-sensitive medical evaluation is critical in all suspected stroke cases.